The Richmond Chamber of Commerce held its monthly luncheon at noon at EKU's Perkins Building. For a guest speaker, they brought in physician and state senator Ralph Alvarado, who gave a speech on the drug epidemic in Kentucky.
At King Brothers Used Cars in Winchester, they'll treat you like family. Come in and drive away in a new-to-you vehicle, courtesy of King Brothers, or visit kingbrotherscars.com to see their inventory. King Brothers Used Cars, family-owned and time-tested since 1966.
Yeah, so we've had some recent bills this past session. We passed a couple of bills to help with disposal of narcotics. I mean, there's a lot of aspects of when it comes to opiates of what we're doing in terms of trying to cut down the prescription, but there's also people that have old pills that are out there that don't know how to throw them away or get rid of them. So we're trying to decrease the burden of pills that are out there. So we've got a new bill that we've passed requiring our pharmacies to at least offer a means of disposal for narcotics. There's a powder you can actually mix in with those pills now into a container, mix it with water. It gums it up where it's biodegradable and safe to dispose of in the garbage, and it can't be abused by someone if they do find it. So in that regard, we've got a new bill that we've passed. We're also constantly passing and looking at bills to try to really to hammer people that are trying to import drugs into the state, to do that illegally, people that are dealers that are bringing in things like methamphetamines or other kinds of fentanyl or injectable drugs and narcotics that are harmful for people. So we want to go after those folks. And then people that are actual addicts that are seeking treatment and help. We've had some new grant money that's come in, I think over $30 million the state's going to be applying towards helping, with the treatment of the addiction and the disease. And it's just constantly trying to find providers and people that are willing to provide treatment and medication-assisted treatment for people to get them off those drugs. So back in 2011, the state passed the pill mill bill, we called it back then. It put a lot of new regulations on providers if they want to do right narcotics and prescriptions. And we've looked at the data since 2011 to 2017. Overall, as a state, we've seen a 10% decrease in the actual amount of controlled substances that are being prescribed. Opiates are down, I think, even more than that. So we still have a lot of docs out there that are still using narcotics, but we're having our trauma centers, our academic institutions are looking at other means of how to treat pain. We're not using narcotics first line. Even with fractures or traumatic injuries, people are receiving Tylenol or ibuprofen, and they're getting adequate pain relief with that initially. So sometimes avoiding that first taste of a narcotic for pain control avoids an addictive situation for an individual. And so we're trying to use more of our traditional pain medicines instead of having to use the heavier duty narcotics right out of the gate. We're trying to reserve those for special cases. The situation is opiates. It's an underground market, unfortunately, the drug trade is. So they take a look at what people are wanting or where the demands are, what they can manufacture for less and maximize their profits. So drug dealers find that they have huge profits when it comes to amphetamines right now. That's back on the rise. They're getting a very pure product, and people are often overdosing with these things. But again, it shows you that addiction is more of a disease. It isn't, there are lots of factors to this, that if someone's an addict, they're just wanting a high. And so the drug that's available and that's cheapest is what they're going to typically gravitate to. And most of our law enforcement agrees that methamphetamine is back to a major spike right now. So that opiates are still out there, but we're seeing less of that and more of a methamphetamine push right now in the community. Just an honor to come to the Chamber today and be able to talk about kind of the state of Medicaid and a lot of the medical issues that are facing the state, and excited to be able to be a voice to help propose legislation and things that will help kind of advance healthcare, the prevention of disease, and to make Kentucky one of the healthiest states in the country.
With WBON TV, I'm Lance Gaither. And for more stories like these, go to WBONTV.com.